Well, happy Saturday, everybody. I hope you are doing well. Yes, this is a Saturday morning. I just thought I would shoot a video. And on this video, it's something that's interesting. I just actually left a friend at a chiropractor's office, and it made me think of what the title of this is: competition versus outcomes. So when my wife and I used to have our practice in northern Wisconsin, we definitely had competition both from a chiropractic perspective and from a physical therapy perspective, with my wife being a physical therapist. Now, there was no competition as far as a multidisciplinary practice. In other words, there was no combination of physical therapists and or a combination of chiropractors. So we were very unique to in our area and in the surrounding areas. So that allowed us to have some differences in separation from what we did. However, as I was just in with this doc in his office, because I'm dealing personally with a long history of a foot injury after a fracture, metatarsalgia, bursa issue, and I'm struggling with the workout, and I'm struggling with running in first steps in the morning is tough, so it's not plantar fasciitis, it's a whole different situation. But when I was in practice, or when you are in practice, you have to look at what is the best way in which you can have outcomes for your patients and for your practice that are best for everybody concerned. So yes, competition is important to have because it will drive you to always be better than your competition. Your competition may not be doing what they can and or should be doing to get ahead of you, so you have to do what you have to do from a practice perspective, a skills perspective, and a marketing perspective to always be one step ahead. You should always be looking to have position one in Google. You should always be looking to have more reviews than your competitors. You should always be looking to have the best in clinical skills in your practice than anybody else in your community. And yes, whether you're a chiropractor like myself or a physical therapist. However, there are limitations that you may have personally and limitations that you may have from in your practice. And here's where you can actually get better outcomes for your patients and truly better outcomes for your practice. So I'm currently seeing this doc for some shockwave therapy and some other stimulation stuff that's unique to him, his practice in the community, and unique to me. We still have microcurrent. I treat myself, but I need some help. And my thought process is, in the complex where he's at, there's this new place called the Stretch Club. There's also a pain management physician, and there's also a chiropractor 50 yards away. I don't believe there's a physical therapist in this section. But the situation is, the chiropractor that's across the street doesn't have these types of modalities. And they do IVs, they do PRP, they do stem cells, they do different kinds of situations. And how often is it when you have a patient that's sitting in your practice that could benefit from what a competitor has? Now you have to look at this from the patient's perspective. Would they be more likely to refer to you or your competition if you help them out? It will actually be both. They're going to run into more people that need more of the general situations that's going on, so they would refer back to you, and they would expect and understand that if you can't take care of them, you would refer them to the office that may be able to do that. So that's something that you have to look at yourself, is from the competition standpoint, can your competitor help your patient better than you can? And should you utilize that competitor? And the truth is, we all took an oath of do no harm when we're in practice, and that means provide the best service we can for our patients. And that may be referring to somebody else. Now, I will say from a personal perspective, in all of the practices that I've been in, I have maybe received, let's just say, 5 over a 20 plus year career of referrals from other chiropractors into any of the practices I've been at. Even in my own practice, they were afraid to refer to me as the chiropractor because they didn't want them to see a physical therapist, or we had some that didn't want them to be referred to physical therapy because they were afraid we were going to force them into chiropractic care. And that's not how it was. So we did our best. If there were other providers in our community that had services that were different and or unique to ours that our patients couldn't do better, and we refer them, or the truth is we'd end up purchasing the equipment that could help that patient get better. So this is something that I just want you to think from an overall perspective. What can you do better for your practice in regards to a competition value to make yourself stand out, and from an outcomes value for your patients? In other words, there are times in which your patients should potentially be referred to another provider in your community. Yes, chiropractors refer to physical therapists, and yes, physical therapists refer to chiropractors, and or vice versa. It's a fantastic marriage. Believe me, I know. I love my wife. We're married. It worked fantastically together. It worked fantastic for our practice, and the truth was, it worked great for our patients. So if you are a private practice healthcare professional, a chiropractor, a physical therapist, a podiatrist, a medical doctor, a pain management specialist, anything like that, and you're looking for ways in which you can find out how you can utilize your services and reach out to your competition and show that to them how it can help them better, or unique ways in which you can essentially benefit your patients' outcomes by referring out, we'd love to have a conversation with you. Let's see. If you're watching this on any of our social channels, you can just comment below, let's just say the word outcomes. And if you're watching this on one of our landing pages, you can just fill out the form. We'll have an understanding where it comes and we can have a chat with you. Because if you are looking to grow and scale your practice and you want to be the number one practice in your community, or you want to help your patients get better outcomes by referring some other people, let's have a talk how we can help you to do that with integrity, with ethics, and the number one thing in mind is growth in your practice, and the number two thing in mind is results for your patients. So we'd love to have that opportunity with you. Again, my name is Dr. Terri Baron. We work with private practice healthcare individuals in order for us to help you grow and scale. And if you are looking to do that, we are looking to do that for you as well. So just set yourself up for a triage call if you wish, or just drop the word outcomes below and we'll know that we can reach out to you at that point. So thanks again for your time today. Enjoy your weekend. Enjoy your week. If you have any questions, drop them in the comment section below. I look forward to getting back to you. Take care. Bye for now.